The COVID-19 pandemic has reshaped life as we know it. As cases of COVID-19 begin to spike across the country, it's important to stay steadfast in helping prevent further spread of the virus. As we've learned throughout this pandemic, the most common way COVID-19 spread is through person-to-person contact. When an infected person coughs, sneezes, or talks, they produce respiratory droplets that can travel about 6 feet and can land in the mouth or noses of those nearby. COVID-19 can also be spread by people who don't know they have the virus since they aren't experiencing any symptoms. Many of us are staying home, avoiding people on the street and changing daily habits, like going to school or work in ways we never imagined. While we are changing old behaviors, there are new routines we need to adopt. First and foremost is the habit of wearing a mask or face covering whenever we are in the public space.
Wearing a face mask will help prevent the spread of infection and prevent individuals from catching airborne infectious germs. When a person coughs, talks, sneezes, they can release germs into the air, then can infect other people around them. Face masks are part of an infection control strategy to eliminate cross-contamination. So there are 3 main things why we should always wear masks.
Masks and face coverings can prevent the wearer from transmitting the COVID-19 virus to others and may provide some protection to wearer. Multiple studies have shown that face coverings can contain droplets expelled from the wearer, which are responsible for the majority of transmission of the virus. This surge control approach reflects a shift in thinking from a medical perspective. Will it protect the wearer? To a public health perspective, will it help reduce community transmission and risk for anyone?
Many people with COVID-19 are unaware they are carrying the virus. It is estimated that 40% of persons with COVID-19 are asymptomatic but potentially able to transmit the virus to others. In the absence of widespread screening tests, we have no way of identifying many people who are silently transmitting the virus in their community.
Universal mask use can significantly reduce virus transmission in the community by preventing anyone, including those who are unwittingly carrying the virus, from transmitting it to others. Disease modeling suggests masks worn by a significant portion of the population, coupled with other measures, could result in substantial reduction in case numbers and deaths.
Masks are not perfect barriers to transmission, but they do not need to be perfect if they are not used alone. Universal mask use should be accompanied by other public health measures, such as physical distancing, testing, contact tracing, and restriction on large gatherings. Those measures are not perfect either, but when many imperfect measures are combined at the community level, they can be very effective at slowing transmission and reducing infections. Masks can also reduce the inequitable impact of the pandemic, particularly for those who live in crowded environments where physical distancing is precarious, and for who work in frontline roles where there is a greater risk of exposure to the virus. So, be a wise citizen and be aware of viruses for yourself, your family, and others. Thanks for watching this video. Don't forget to like, comment, and subscribe.